We're now moving to item L1, which is the first item on the consent calendar. Item L1 is to receive a report on the health effects of sugary beverages on childhood obesity in Richmond by Contra Costa Public Health Director Wendel Bruner, MD, PhD, and 2, adopt a resolution directing staff to prepare for the City Council's review and consideration 2 draft ballot measures intended for the general election of November 6, 2012 to help diminish the human and economic costs of obesity and dental disease among Richmond residents.
Thank you, City Clerk. This is an item that is initiated, introduced by Councilmember Ritterman. I'm proud to be a co-sponsor along with Vice Mayor Butt, but I will hand it over to Councilmember Ritterman to frame the item.
Well, I want to thank Dr. Bruner and his team from the Contra Costa Health Services for coming and giving the report. We don't really have great health statistics for Richmond, but one thing we do have is the heights and weights of our 5th through 7th graders. And so you can calculate their obesity rates, and as you're going to see, they're actually frightening. And so we're trying to figure out both digesting the report and then coming up with a plan to intervene. So after Dr. Bruner's report, I'll mention a little about what we hope to do with in Richmond with these statistics. I will just say that we're kind of on the cutting edge here. What we're proposing hasn't been done really anywhere in any city in the United States up to this point. So, Dr. Bruner.
Welcome, Dr. Bruner.
Thank you, Mayor and Council members. I'm Dr. Wendel Bruner. I'm the Director of Public Health for Contra Costa Health Services, and also by resolution of your City Council for the City of Richmond. I have a PowerPoint, thank you. And so I want to talk about the impact of sugar-sweetened beverages on the health of the residents of Richmond. And this is particularly important in the City of Richmond. The epidemic of obesity is nationwide, but here in Richmond and in West County, we have a particularly high rates of obesity with its associated diseases. This is also important because, as we all know, in Richmond we have high rates of a lot of diseases and illness, plus considerable economic stress that people are under, all of which makes the health impacts of obesity and overweight particularly important here in the city. We're talking about sugar-sweetened beverages because the sugar in sugar-sweetened beverages is the leading source of essentially worthless calories in our diet, and in particularly in the diet of our youth and teenagers. As Dr. Ritterman mentioned, we have good data about the obesity rates of our children because they're surveyed in 5th, 7th, and 9th grades. This is data, countywide data from 2009 of 5th graders and of all the elementary schools in the county, and we've broken it down by color codes so that those schools in black have the highest rates of obesity. 36 to 61% of the children in those schools are overweight and obese compared to other schools. And you can see that the black schools with the high rates of obesity are concentrated in the low-income areas of the county. Out here in West County, central part of county and Concord in the Monument Corridor area, Bay Point, Pittsburgh, and the northern part of Antioch in particularly. But if we look at the West County area, we see that most of the schools in Richmond have the highest rates of obesity, or the second highest rates, that is the red schools, and that we have a particularly high concentration of childhood obesity here in Richmond. Looking at the most recent data for all 5th, 7th, and 9th graders in public schools in Richmond or schools that surround Richmond and serve a high percentage of Richmond population, we see that over half of all the children in our schools here are overweight or obese. That's 52%. That's higher than Contra Costa County as a whole, which you can't see from this graph, but it is 34% overweight and obese. California, where the figure is 38%, or here in Richmond, where, as I mentioned, over half the kids, 52%, are overweight and obese. Obesity in children and young people is particularly important, not so much that they get the cardiovascular disease and the diabetes when they're kids, although that is beginning to happen, but because children who are overweight and obese tend to grow up and become overweight adults, where those diseases have the major impacts. If we look at the prevalence of obesity in Richmond adults, this is data that's not as good as we have for children, so these are more of estimates based on larger survey data in the Bay Area and California, and only some of the data from Richmond. But they're pretty reasonable estimates. The obesity prevalence in adults, 24% of the adults in Richmond are obese, 34% overweight, so we have 58% overweight and obese. But if we look into the future, currently, over here on the left, 24% of adults are obese, and we have 32% of our children are obese. As those children grow up and become adults, we anticipate that in the future we will have 42% of the adults in Richmond obese and at severe risk for health problems. Now, this isn't going to happen overnight, and it's going to take years as the children move through their life's course and grow up and become older and develop the chronic diseases that older adults have. But this is the direction that we are going now in the city of Richmond. This is important because of the health impacts of obesity, particularly obesity rather than overweight. If we look at some of the major health problems that are experienced here in Richmond, hypertension, diabetes, cardiovascular disease, these are associated with obesity. And we can estimate, based on a literature review and studies, the excess diagnoses that people in Richmond have of hypertension and diabetes because of their obesity. And so we looked that we have about 8,000 residents of Richmond have hypertension based on their obesity. That's currently. But if we look